Okay, so I received my first hip replacement back in 2020. Prior to the surgery, I had uncomfortable nights, days. It just continued to get worse. Was always told I was too young to get the hip replacement. I should wait a little while. But as it turns out, it was much needed. Hate I procrastinated and waited as long as I did because I went from painful nights to a lot of rest. So it was a great move. James Logan was my doctor. He's awesome. He's also my childhood friend. We grew up, went to school together, kindergarten through 12th. So I felt very confident in him being my doctor. And the process was seamless. I was back up and moving in 3 weeks at most. Therapy was great. And now it's time for the other one. So of course, James was my preferred choice. Okay, so with the hip issues, it caused issues walking. I would go up flights of stairs for work, so it was causing complications there. Just a day-to-day routine, not able to play sports or just hang out with the friends as much as I would like because it was the pain. So instead of sacrificing that, I went ahead and had the surgery, and I have no regrets. Roughly about 4 to 5 years. Yeah, roughly about 4 to 5 years, and it was enough, so it was time to make a move. It's been roughly 5 years since the last surgery. Yes, I am. Oh, it was just everything. It was the peace, being able to rest at night, getting up and down without any issues. To be so young, I didn't want to feel confined by my hip. So after the surgery, I was back to moving with no issues at all. I would say don't procrastinate. It's not a huge incision this day and time. It's a small incision. It goes away. You can barely see it after a few years. I would say maybe 3-4 inches at most. And it's no reason to be in the pain that you're in. Just eliminate all that. Forget the procrastination. Get on with your life. Well worth it. Severe pain, I would say the medication they give really helped, but the first 2 to 3 days were the worst, especially at night, getting up and out of the bed, going to the restroom perhaps was one of the worst cases, but it's not worth the pain you endure the entire time. 2 to 3 nights for months, years of pain, it was a no-brainer. Yeah, I do have support. My husband's a great supporter. My kids are always there. Granted, initially I was sleeping a good bit, so I didn't need as much care, but they were there as the caregivers, and I would say that would probably be a vital part. You do want to have a support team there to help, if at all possible, but the rehab team that comes in, they're great as well. They give you little pointers to help make things a little easier.
So this is a 50-year-old lady who's had a prior right hip replacement, is now having left hip pain, and then on her x-ray she does have pretty severe arthritis in her hip, pretty much completely bone on bone here on the inside part of the hip, bone spurs around the outside part of the hip, so definitely has reason for it to be hurting. So we'll go talk to her and see how she's doing with it. Hello, hey, I'm doing good, how are you? How you been?
Been doing well.
Been doing good?
Yeah, good to see you.
Yeah, you too. The other side's giving you trouble now?
Yeah, it is, unfortunately.
That's no good. How long has this been bothering you?
It started before we did this.
Oh, so it's been the whole time.
So it's kind of
just been gradually.
Worse.
Gotcha. Is it to the point where you're ready to?
I'm ready.
Ready to do something with it?
It's not worth the pain. It's
Yeah.
not worth the shot. I'm just ready.
Yeah. Well, you know from before, you know how the other one did. I mean, there's no need to suffer with it.
And I've been doing that. Yeah. I'm not going through it. As long as I did for the first one.
Yeah. Exactly. Well, you know, obviously, you know, our X-ray, you know, bone is completely bone on bone, so pretty severe arthritis, lots of bone spurs around the hip. So definitely have reason for it to be hurting. Hip replacement I think should do well for you, just like it did on the other side. Take the bone spurs away, take the bone from rubbing together, and the big thing is get that pain to go away. So, yep. Any questions about it? I know you've been through it before, but it pretty much do exactly the same way. So hopefully everything will be just as smooth as the time before.
That sounds great.
Sounds good.
Yep.
All right. Do you want to go ahead and talk to the scheduler?
Yes.
Okay. Well, come on up here with me, and we'll go talk to her and see what we can work out for you. Okay.
Thank you.
You're welcome. All right. Beth will get everything scheduled for you, and then we'll get you fixed up, okay?
Perfect.
So good to see you.
You as well.
Hey, my name is Rebecca Dozier. This is my 5th replaced joint with Dr. Logging. I had my left shoulder reverse replacement about 7 weeks ago. I had it replaced because I have a soft tissue disorder, and I waited about 2 years before I actually went ahead with this surgery. I couldn't move it at all. I realized right before the surgery I wasn't using it at all. I was using my right arm to drive, I was using my right arm to lift things, to pretty much do everything. So I had the surgery. After surgery I was in a little bit of pain, but I've been able to, with therapy and the surgery, get a lot of movement back. My quality of life has increased like 100%. I'm able to drive with it. I use it for everything now. I'm still in therapy, getting stronger every day. Like I said before, I've had 5 joint replacements. Dr. Logging's the only person that I would have do any of my replacements. And he's the only one that I've found that would help me out since I was so young when I started getting replacements. Most doctors want to make you wait and kind of suffer until you're older so that you don't have to have them done again, whereas Dr. Logging really focuses on your quality of life and how much more you could be enjoying it if you have your joints replaced. I'd like to get back in the gym. I had lost a good bit of weight and I'm trying to build muscle back, and so I'm excited about doing that. And just continuing to get better at things that I wasn't enjoying before because I had waited so long to have it replaced. Definitely take the plunge. Surgery can be scary. I have felt so much at ease in this practice and with Dr. Logging, but once you have it done, your quality of life will definitely improve, and you just have to get off the fence, jump, take the plunge. 7 weeks.
All right, so this patient's 7 weeks status post left shoulder replacement. So here's our replacement implant that's in there. Alignment looks great, so everything's looking good. So we'll go see how she's doing. Hey, good morning. How we doing?
Very good.
Doing good?
Yes.
All right. So 7 weeks since surgery.
7 weeks.
How's things coming along?
Wonderfully. The pain is so much better since before surgery. The only problem I'm having is just getting the nerves back
Sure.
to feeling like they're part of it, but my mobility is so much better.
That's amazing.
I can go behind my back.
Good.
Go out. Therapy and surgery has helped tremendously.
Wonderful. Yeah, I mean, your mobility's amazing. I mean, a lot of times people don't even get all of that mobility back, and it usually takes at least 3 months to get there. And so, I mean, we're at 7 weeks. I mean, you're, almost at where you would be at the end.
I think that because I wasn't using it so much before, because the pain was just so bad beforehand,
Right.
that having it replaced has been amazing.
Yeah, it was in pretty bad shape. So
Was it?
So I know it was giving you trouble, but yeah, you've done great. I'm super proud of you. So.
Thank you so much.
Oh, you're welcome. Yeah, so basically what I'd recommend is just keep working with therapy. Big thing is working on building the strength back up. They'll continue to work on mobility, but it's looking great. So I mean, I'm super proud of you.
Yes, I'm getting used to getting them replaced. Maybe that's part of it.
Right.
Practice makes perfect.
That's right. That's right. Any questions about anything?
I think I'm good.
You're good? Okay.
Good.
All right. Well, I'm going to have them make you an appointment for a couple months to check back, and then we'll see you then and see how things are doing. But
Okay. Thank you.
you're welcome. All right. So 6 weeks status post left total knee replacement. X-rays look great. So we'll head in and see how we're doing. Hello, hello. How are you, sir? How we coming along?
Good.
Making progress?
Yeah, surgery was on a Wednesday. The block didn't go completely away until Friday.
Oh,
which
wow.
is a good thing.
Okay.
First 10 days were tolerable.
Okay.
Next 6 nights, sleep was next to impossible.
Ah,
On a scheduled visit with Victoria, we got the meds squared away.
okay.
Okay? And I didn't have no problem sleeping after that.
Okay, perfect.
Somewhere around the 32nd day, it was the first time that the pain was generally limited to my knee. Mm-hmm. Now, occasionally, I get a shooting pain from my knee up to my hip. Mm-hmm. Not all the time.
Gotcha.
I continue to have pain on my calf, which was there before the surgery.
Okay.
It's like a stone bruise.
Right,
And that happened long before the surgery,
right.
and it's still there.
Okay.
Now, I did my home health. They said you need to go to a PT. Mm-hmm. So I tried two different. I tried Dreyer and Chapin. Mm-hmm. The only reason I went to Dreyer is they would give me soonest.
Right, sure.
Okay, Chapin said we can't see you until the 8th.
Right.
That would have been last week.
Right.
So anyway, I went with them. Now, I've had 2 previous visits canceled with Dreyer.
Okay.
So I've only seen them 3 times.
Okay.
Now I got 3 more to go that are scheduled.
Right.
1 tomorrow.
Okay.
And 2 next week.
Okay.
Now, according to Dreyer, I can bend and hold my knee to 112 degrees with no problem.
That's great at 6 weeks. Yeah, that's really good.
And I'll continue with the home exercises. Unless you tell me I have to go to PT, I don't plan on going unless there's a chance of scar tissue.
Yeah. Well, I mean, there is a chance. As long as you work it at home, though, on your own, you don't necessarily have to go to PT, but real important to really, keep working it as much as we can. 112 is great. Ultimately, we want to get to 120, but that's usually 3 months after surgery. So, I mean, you're almost there and you're only halfway to that point. So, I'm proud of you. I think you're coming along good. So, you could do it on your own, but it's kind of up to you how you
The
feel.
only advantage compared to what they show me or what they have me do at PT and what I do at the house is they got a better ice pack.
Right.
I mean,
Other
they
than
haven't
that.
shown me anything, they put me on the incline. Mm-hmm. We do the pull up the knee.
Right.
We do the press and hold.
Yep.
I do all that at home.
Perfect. Yeah.
Okay.
Now, I think you could do it at home then.
So the only thing that concerns me is, like you say, scar tissue.
Right.
Is it?
You're still at risk for it at this
Really?
point. Yeah, I mean, after about 3 months, then usually you're kind of past that point. But even right now, like if you stopped working it, you'd get scar tissue.
Well, I don't plan on stopping.
Yeah.
I mean,
So as long as you keep working it, then you should do good.
Okay. The only other thing I had was a possible renewal on my pain prescription.
Okay. Yeah, we can renew it one more time, but this would have to be the last one, so
That's
we want to
fine,
wean off
but
of it.
The
so.
only reason I'm asking for it is to get me through the PT.
The therapy, yeah, that's not a problem. And then same pharmacy we've used before.
Publix and Chapin.
Okay, so we can send that in there.
Other than that, how am I doing?
Yeah, I think you're doing great. I mean, I think, swelling's really not too bad. Normal to have swelling, really takes about 3 months for that to kind of fade away. Still normal to have some pain. Again, that takes about 3 months. But all in all, your mobility's come along really good. The knee itself looks good. Your x-rays look great. So, I mean, I'm proud of you. I think you're doing really well.
So I'm not complaining, I'm just asking.
Yeah.
So I shouldn't expect the pain to go away until October.
So yeah, for another 6 weeks at least, you'll have some degree. And even after that, you may have some soreness here and there, but most of it settled down by 3 months
So
afterwards.
by Thanksgiving, I should never know that I've had a knee replacement.
I mean, it still may be a little achy here or there, especially with weather changes and things like that, but it'll be a whole lot better for sure.
I'll be
by
able to
then.
get up and down off the tractor.
Oh yeah, for sure.
Okay.
Yeah, but I think we're coming along good. So I just kind of keep working it, either with therapy or on your own. And then I'm going to check you back in a couple months just to make sure we're still making progress with it. Sound good?
Good.
All right, my friend. Well, I'm proud of you. You're coming along good. If you give them this up front, then they will get you that appointment for a couple months,
you,
okay?
sir.
You're
Have a
welcome.
pleasant day.
I hope you do too. Take care, okay?
All right.
Have you done before, or is this the first?
This is the first.
time?
Yes.
And it was just the 1 foot, the left?
The left.
Okay. All right, well, let's see what we got. Hey, good morning. I'm doing good. How are you?
Good.
All righty. We're gonna get our Botox injections, is that correct?
That's right.
Okay. And then remind me, our issue is more, this is what spasms up this toe?
It starts in the ankle right there, and it draws it up like that.
Draws it like that. Okay. I'm gonna let you contract that again for me. Just mark out.
And when it does, I feel it all the way on the back side of my leg here.
Yes, sir. How far back do you feel it?
It'll actually come right on up sometimes.
Does it?
It'll come all the way to my knee every time.
Okay. All right, you can relax. All right, we're gonna see if this will. So hopefully it will help. You know, it takes really about a good week for the medicine to really start to work. You may notice something in a few days, but you know, I'd give it a good week or so, and then just see how that affects it. You know, we'll make an appointment to come back in a few months. If it does really well, you know, we can obviously redo the Botox every 4 months to kind of keep it under control and just take out that spasticity. If it doesn't, then you know we don't have to keep doing it, obviously. But my hope is it's gonna calm that down.
I hope so.
Yep. All right, you ready?
Good weaken my leg some.
So it will, because you know basically what the medicine's doing is it's blocking the nerve function on that muscle, and so because of that, yeah, you do get weakness in that muscle. But that's what we want though, because right now it's overstimulated, and so we're trying to knock that back some. So, you know, it's not going to like completely paralyze the whole muscle, but it's going to weaken it so that hopefully we don't get that.
All right.
Sound good?
Sounds good. I hope it works.
I hope so too. You ready?
I'm ready.
All right, it's going to be a little stick here, okay? Actually, let me change this needle. They got you with the big needles. Let's put the smaller ones on.
He got you with something I use on the farm.
That's right, exactly. We don't want those, do we?
I don't think so, not the first time.
Not the first time, that's right. Okay. You ready?
I'm ready.
All right, here we go. It's gonna be a stick. Okay, another one. And another one. Doing blood thinners at all, or? You're not on blood thinners or anything, are you?
No.
just get these. Will you open me 6 more Band-Aids? Yeah, we're gonna stick you a few times, I'm sorry.
That's all right.
But I'm just going to go ahead and, those were bleeding a little bit, so I'm gonna go ahead and get these Band-Aids on there.
I've been waiting about 14 years for this.
Is that right? You've been putting up with it a long time.
I have.
Well, hopefully this is gonna be the answer.
No one has ever recommended Botox.
Yeah, I mean, the problem is unfortunately, as a lot of people don't think about it and they don't do it. Obviously, if you don't do it, you don't think about it.
Right.
And so it's just kind of like, oh yeah, there's not much you can do. And so, but the Botox is a really good option for people who have that kind of spasticity or where the muscle's just overstimulated. And so I'm hopeful this is going to do good. It's definitely worth a try.
I guarantee you. The worst time is when it gets you hemmed up in a car when you're taking a trip or something.
Right.
You don't have any room to give it room to work.
Right.
I have room that I can get up and walk it out. Most of the time it'll go away in just a little while.
How long does it normally last when you get a?
It depends. If it's where I can get up, I can walk it out in 5 minutes.
Is that right?
And sometimes it'll come right back, but say if you're in a car taking a trip or something, it may last 2 hours.
Is that right?
Or
Wow.
3 hours.
That's got to be miserable when it's that long.
We go to South Dakota hunting, and I remember we were coming back. No, that was Arkansas, but we were coming back, and it started. Outside of Louisiana,
Right.
and we were all the way to North Augusta when we stopped to get gasoline, and I could get it away.
Is that right? No. You'll be Band-Aided up.
Band-Aided.
Yep, just a few.
It's all right. I just hope it works.
I do too. Well, let's do this. Let's make an appointment for like 6 weeks or so, just to see how it did.
Okay.
And then we can decide whether we feel like it was worth, continuing. Then we can get it rescheduled to redo it if it does.
All right.
Sound good?
Sounds good to me.
All right, my friend.
Sounds good to me.
So if you give this to them up front, they're going to get you that appointment for about 6 weeks, okay? There you go.
Thank you, sir.
All right, if you give them that, and I'll see you in about 6 weeks.
All right.
We're going to hope
Thanks,
for the
sir.
best.
Appreciate it.
Yes, sir. Have a great day, okay?
Thank you.
So, 84-year-old patient, 7 weeks, status post right total knee replacement. X-rays look great. So good alignment, implants look good. Little arthritis on her other knee. But everything's looking good. We'll go see how she's doing. Hello.
How are you?
I'm doing good. How are y'all? Yeah, all right. Well, how are we coming along?
Pretty good. Pretty good.
Pretty good. Making progress.
A little bit warm sometimes.
Yep, and that's pretty normal. I normally tell people for the warmth to go away because it's just the healing that's going on. So there's increased circulation. Normally takes about a year for the warmth to go. So you'll 6 months from now you'll touch this one and be like, oh, it's still a little warm.
Yeah.
But it takes about a year. But look at that mobility, that flexibility.
She's been doing great.
Yeah.
She did better than I
Good.
did.
Did she?
The time she got home, she was just throwing that leg up on the bed,
Yeah.
moving around.
Yeah, for 7 weeks, mobility is excellent. I mean, I'm really proud of you. So I think you're coming along really good.
I do my exercise constantly right now.
Perfect. That's gonna, yeah, the more you do that, the better it's gonna keep getting. So, and you're still working with therapy?
No,
Or just doing it on your
On
own?
our own. They said
Man.
she didn't need to go
didn't
anymore.
even go anymore.
Yeah, so they turned you loose.
Yeah.
You said you were too good.
Since I'm doing really excellent.
You are doing excellent.
She
So,
started-
And the scar looks good.
scar's looking great. Yeah, are you putting anything on it?
That cream that
You're
you
putting my
bought
cream?
from me, yeah.
Okay, perfect. Yeah, it's looking really great. So it's healing nicely. That's gonna fade away. I think once it's healed, it'll be hard.
And this bone right here hurts a little bit.
A little bit on that outside.
Outside bone.
Yeah, some of that's probably muscle.
And also I hear click, 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 okay.
Yeah, so that's pretty normal still with the swelling that's there. Most of the time people will say that eventually goes away. You know, occasionally you can hear the clicking of the components themselves.
Yeah.
And so, but that's normal. But usually most of that goes away with time.
Okay.
So, but I think you're looking great.
It's not so loud that, yeah, Pam says she don't hear it.
Done.
No, it's
Yeah.
just you.
All right. Well, I just kind of keep doing those exercises and therapy, and so hopefully that strength just keeps getting better and better. Normally, I would check you back in a couple months. Do you want to make an appointment for a few months, or do you want to just call me since you're doing pretty good?
We can just call.
Just call?
She'll come back up here when I have mine
Well,
in
she-
October.
yeah.
Okay,
October,
perfect.
I will come.
Okay. Well, we can check you then just to
Okay.
make sure, but I'm proud of you. I think you've done really well. So,
Thank you.
any other questions?
No,
That's
but I
it?
really try to take care of it.
Yes.
Now I get up and walk a lot too.
That's good.
I go outside and go to the mailbox and I walk about half mile this way about every other day.
Yeah. No, that's great. I think it's really good.
Because I like to get outside and it's not stopping me, I'm still doing it.
Right.
But I watch my steps and I try to be careful.
Right. That's great. You're doing everything you should. I'm proud of you. All right.
Glad you did it for me.
Yeah, oh, absolutely. Happy to help. So if you give that to them, they'll get you checked out, and then I guess I'll see you in October.
Yeah.
All right.
Thank you.
Good to see you.
too.
Y'all have a great day, okay? And then you'll just go around to the left, okay? Bye. Take care. Proud of you. All right, good morning.
Good morning.
Good morning. How we doing?
Doing great.
You ready?
I'm ready.
All right. Any questions about anything?
I don't think I have any.
Nope.
No.
Just ready to get it over with and get to feeling
Yeah,
better, right?
yeah, yeah.
All right. And then ready to walk. I hear you. And working on the left knee today, correct? Okay. So I'm going to put my initials over here so we all agree this is the left one and the one we're working on.
Please do.
Exactly. Exactly. And then surgery takes about 45 minutes to an hour, so not too long. And then I'll come and talk to you when we're done and let you know everything goes, okay? All right. No other questions?
No.
No? All right. Well, can I say a little prayer with you before we go back? Is that
Would you
okay?
like to film this underwater? Because I know you're very good at it.
Yeah, I know. We'll stay above the water for this one. So,
All right.
Heavenly Father, we just come to you thankful for your many blessings, and we're so thankful for Mr. Clegg and ask that you be with him as he undergoes his surgery today. Lord, we hate he's developed the problems in the knee and the pain that he's been having, but we ask that you allow the surgery today to be successful, to fix the problems that are there and just take this pain away, and for him to enjoy life without that pain. Be with him during the recovery period, just give him patience and allow him to recover well. Lord, we know through you all things are possible. All these things we ask in Jesus' name we pray. Amen.
Amen.
All right.
Thank you.
You're so welcome. I'll see you shortly, okay?
Very well.
And like I said, I'll give you a call when we're done, or come talk to you when we're done, okay?
Okay.
All right. Thank you. Yeah, exactly. Yeah, and you know, if they get a venous tourniquet, then you're going to increase bleeding. So that could be, but that's the only thing I could think of. Wow. hard. Yeah, pretty significant contracture. It's gonna go slower.
Have you been doing that with it? You got
It's just a different type of cartilage than the articular cartilage that's on the end of the bone. But
Okay.
perfect.
Okay, good job.
All right, great job, Victoria. Great job, James. You're the best, Mel. Thank you. Okay, just finished up the total knee. Everything went really well. That knee was in pretty bad shape. I mean, just severe arthritis, bone on bone, lots of bone spurs, but the replacement turned out great, so hopefully that's going to do really well for him. So we're going to go talk to his family and kind of let them know how everything went. Hey, we're all done.
Good.
Everything went great. That knee, poor knee, was horrible.
I know.
It was really bad. Just completely bone on bone. So many bone spurs everywhere. I mean, I know it was giving him a fit, but everything turned out perfect. Got it nice and straight. Corrected that alignment. No, replacement looked great. So that should make a big difference for him.
Good. I hope so.
I think so. Yeah. So they'll get him over to the recovery area here in a little bit, get him situated, and then they'll come give you an update. Okay. So just hang tight right here.
Okay.
But he did great.
Thank you so much.
You're so welcome. You have a great day. Okay.
You too.
Thank you. All right, so 2018, this gentleman had a right hip replacement. He's been having some left hip pain. He's got pretty significant arthritis, bone spurs at the left hip, and just been checking in ever so often. So, hey,
How you doing?
I'm doing good. How are you, sir?
I'm doing fine, thanks.
How are things?
Holding steady.
Holding steady?
Still no sensations at all
Okay.
at the hip. So, what do we say? Push it back, wait and see for another 6 months. The only thing that concerns me is, a couple things, I guess. If I suddenly have to go to bone on bone and I'm going around with a cane, obviously I'd like a quick turnaround to do the surgery and get it repaired. But then again, there's different times of the year that are more convenient than others.
Sure.
I can't remember from this about how long the therapy regimen.
Yeah, usually people do therapy 6 weeks, maybe 8, but usually not much more than that for the hip.
Yeah, I didn't think it was that terribly long.
Yep.
Because I'm trying to calculate if when it would be most convenient
Sure.
to do it, and then we pretty much stay close to home for 6 to 8 weeks.
Right.
And it works out that that's probably most likely October,
Okay.
and baseball in Florida starts in March.
Right. Sure.
And so I don't know what you call it. I think it was right around the time I was here last time. I'd driven down to Florida. Right before or right after we met.
Right.
But I don't feel like right now committing to sometime in October.
Sure.
That I don't want to, but I don't want to, I kind of want to anticipate
Right.
as possible rather than have it get as bad as it possibly can. What did the x-rays show you?
I mean, x-rays, I mean, you do have quite a bit of arthritis in that left hip. I mean, pretty large bone spur on the outside part of the ball. So, you know, it's not gotten into the road, but it's got a good bit of arthritis in it. So,
We're on borrowed time, but
correct.
It's kind of just that way for, and since it's asymptomatic, I don't feel anything.
Right.
In fact, I do these exercises, I've told you before, I do about 45 minutes a day. And among them, one leg stands, where I stand on this leg. Both kind of flamingo stand, I think they call it, and then another one where I raise up.
Right.
Do a series of those. And this hip continues to outperform this hip.
Is that right?
Yeah.
How about that?
So, and I've not had a twinge of anything. So.
Yeah, it's hard to say, yeah, let's go ahead and do surgery when you're not hurting too bad. So.
Exactly. So
yeah.
I suspect I might want to even kind of push it and think in terms of maybe setting a deadline like this time next year.
Sure.
The other thing is age.
Right.
Well, you notice I had a big one yesterday.
You did, yeah. Happy birthday.
Yeah. So I hit 80.
That's awesome.
Feeling, it's weird, you know?
Sure.
Didn't feel anything at 70, 60, even at 50. 40, I kind of remember feeling like this, I'm getting old. Again, I was sort of battling it this past week, saying, you know, maybe I shouldn't extend my contract for this or that.
Oh, gosh.
But then you know, my parents were very long-lived, and grandparents and so on. So on the other hand, I should probably be optimistic. But that's all to kind of preliminary to the fact that, you know, isn't there an age at which it's increasingly risky to go through?
Well, I mean, obviously, the older you get, you know, the more risk of complications or things like that. But I've done plenty of people in their 90s, and so I mean, the age is just a number. It's just, you know, how healthy you are, how active you are is good. Yeah,
it's good.
So, yeah, I don't think that would be a problem for you. But you never know, like down the road, what may change or happen. But yeah, I mean, if you're doing, you know, not really having a lot of pain at this point, you know, maybe we just do another 6 months to check back, see where it is, re-x-ray it. Obviously, if something changes where it starts bothering you, you know, just let me know. You know, my surgery schedule is backed out, you know, somewhere 5 to 6 months probably.
It is really?
Yeah, yeah.
So it increases the likelihood that I'm going to try to make a decision in anticipation rather than after the effect.
Yeah.
And if so, maybe looking at this time
next year.
Next year, because I got a big conference I want to go to in New York. Got spring training, got 2 beach trips, and you know, all kinds of stuff.
Gotcha.
Everybody has a lot of stuff. Mine's more important than most people's.
There you go. That's right. That's right.
To me, at least.
Absolutely. What do you want to do? 6 months?
We'll check back in 6 months.
6 months?
And tentatively, I don't know who's responsible to try to plan a date as far out as a year.
You could, if you wanted.
Should I talk about it?
Yeah, we can go talk to the surgery scheduler if you said, well, I want to go ahead and get it on the schedule for this time next year. And then if you needed to rearrange it or shift it around, you could always do that.
Well, if you got a lot of backlog, it would not probably be catastrophic if I decided to back out on
Right,
it. You
sure.
could fill it pretty quickly, I'm sure, with some very great.
Yeah, just as long as you give us at least a month or so.
Yeah.
You know, when it gets to be like the week before, then it's hard because.
Yeah, obviously.
But we go talk to her and see.
Okay.
That sound okay?
Sounds good to me.
All right, we'll come on up this way and we'll go talk to her and see what we can get worked out
new to you?
All right, so left knee for sure, pretty advanced arthritis, bone on bone there. Right one's not quite as bad, but still pretty narrow joint space. That's the skiers. New to me.
Yes.
Hey, how we doing?
Hey, how you, sir?
How we doing?
Good, good. I'm doing good.
You're doing
I
good?
brought Mom here to see
You got Mom
We did this in
here?
reverse order, you know.
Yeah, he went first just to kind of scope it out for you.
He did.
Well, what's going on?
Well, I don't really know.
Those knees?
Yeah, this one, it doesn't hurt just to be sitting around, but when I bend it a lot or when I try to straighten it out after sleeping for a while, it hurts all back in there. This one day, it just buckled and I fell.
Oh, no.
But that's been several months ago.
Okay. And it's been fine since.
But I don't know why I did that.
Right. Okay. So this is the one that hurts you.
Yeah, this is the one that yeah.
Gotcha. And have you had injections or anything in them? Nope. Do you take anything for it? Like
No, I don't.
Advil, Tylenol? Nope, just kind of put up with it?
Yeah, well, like I say, just sitting around, normally it doesn't hurt, it's just sometimes it.
All right, well, these are the x-rays on both of the knees, okay? So this is the right, let me just try to zoom in, there we go. So this is the right one here, this is the left one. And what we're looking at is the amount of space between the two bones, and you can see essentially there's no space here on the outside. I mean, maybe a tiny little bit, but it's essentially bone on bone there on the outside part of the knee. You can see the difference between your other side and that side, how much less cartilage you've got in there. Now the right one has some arthritis too, but there's still pretty good space all the way across. So it's hanging in there, but that left one, you know, is basically bone on bone. So you got reason for it to be hurting. You know, a lot of times, you know, if you're just sitting, you know, it's not too bad, but it's when you try to get up and down or walking or things like that or bending it, like you said, you'll notice that pain. You know, the options of what we could do, you know, long term, if you said, what can we do to fix it? You know, knee replacement would be the only option to fix it long term. We could always try the injections. You haven't had those. They probably would help. It's just a question of how long they would last. But they would, you know, they wouldn't last forever, and so it'd be one of those things you'd have to continue to redo over and over. Ultimately, you know, knee replacement is going to probably be the best option.
I kind of figured that.
Yeah.
But I'm not ready for that.
That's totally fine. Would you want to try an injection to see how that does?
That's totally your call.
You tell me.
Mom, they didn't help me much, but I think I'm a little different case at the time. But that's up to you. I was hurting pretty bad though, pretty regularly. I know yours is hurting, but I don't know to the degree. You don't seem to complain about it a whole lot, but
It's just, I know it's there, but it's not a pain that I can't live with at this point. I mean, like you said, if I'm sitting for a long time and get up, I kind of notice it.
Right.
It's still not a pain that's just excruciating
Sure.
or anything. It's just, I'm aware of it. So,
it's up to you.
I don't know about this injection stuff.
She gets nervous with needles.
I
I'm very
understand.
nervous with needles.
Yeah. I'm pretty gentle. They're usually not too
I told
bad.
you,
So
all I felt was a little pressure.
You do that today?
we can do the cortisone today.
You sitting here with me, you gonna hold my hand?
Yeah, I'll do whatever you want me to do.
Isn't he a good son?
Yeah. Second time he's been told that today.
Is that right? Man, he's on a roll. He's on a roll today.
You want to try that?
Oh gosh.
Does it hurt you every day? I mean, I know it does to some degree.
Well, occasionally. I mean, it's not
Okay.
continuous.
Why don't you give it a try?
Okay.
I think it's worth trying at least one, and then we'll kind of know how it
Get yourself
does.
worked up and pass out on me now. Okay.
Yeah, I'm gentle. It's not usually too bad. So
Yourself worked up, I'm just telling you.
no, you're good right there.
He had to get stitches removed one time a long time ago, Dr. Logan, and fainted on me.
Did she? Uh-oh.
Girl, what are you doing?
Uh-oh.
Bringing the brown pot.
Yeah. Just don't look. It's the game show. Just think about the game show. You watch the game show. Which anything you like.
Fresh my luck.
Fresh you up.
Fresh your luck.
Freshen you up today.
Oh gosh.
But you're fine.
Oh
Now you'll feel a little bit of the numbing stuff, but it just still cold a little bit. No big deal.
Yep. So we're gonna put a little alcohol, then we're gonna put that cold spray on there. And that's gonna help numb it up really good.
We're gonna stop at Chick-fil-A and get me a peach milkshake.
There you go.
Peach milkshake on the way home. All right.
That sounds like a great idea.
Yeah.
Before they quit serving them.
Did they stop serving them in a certain?
I think
Well,
they
they
do
don't
them
serve them.
seasonally.
Yeah, they only do.
They
Oh.
don't do them all the time, so.
But is the peach still? They're still serving it?
I think so until maybe the end, maybe for another week or so. I don't know. I know they're gonna stop serving the peach, whatever drink it is. But
We'll get you some peaches while it's still in season.
Yeah, I guess That July, August is
Yeah.
typically peach
done?
season. I'm done.
All done.
oh wow,
See?
still up here, right?
Yeah, you're still
upright.
upright. We're not having to tilt you over and get the blood back to your head and all that.
See, I'm pretty gentle. It's not too bad, was it?
No, I didn't really feel it that much.
Good.
Very good.
Well,
About
good.
peach milkshake
Yeah, well,
forever.
That's what did it.
So if it's December, I don't know what we're gonna talk about. Talk about Christmas. Peppermint.
They got a peppermint. That's what I was thinking.
Peppermint, what's it called?
Oh, goodness. All right. Well, hopefully that will help. Do you want to make an appointment for like 6 weeks or 8 weeks and just see how that did? Or you want to just call me if it's not better? Or?
I'll just call.
Just call? Okay. Well, obviously if it helps and you're like, man, that did really good, a few months roll by and it starts bothering you again, you're like, let me get another one, just call me, come on back.
Okay.
Or if you need anything with it, just let me know. That sound okay?
We'll do it.
Sounds good.
There you go. And I gotta go get a milkshake.
That's
I'm
right.
trying to watch my figure here.
Oh, goodness. All right. Well, if you give this to them up front, they will get you checked out.
Thank you, Dr. Locke. Appreciate you.
You're welcome. Good to see you. So good to see
Good to see
you.
you.
All right. I hope it helps, okay?
Me too.
All right. Y'all have a great day.
I'll see you next time, I guess.
7 weeks on the right knee. Replacement looks good. Arthritis on our left one. 6, 7.
7.
Hello. I'm doing good. How are y'all?
Great, how about you?
Doing good. How we coming along? Doing good? Making good progress?
Oh, yeah.
Yeah, it's looking great. Incision looks good. A little swelling, but that's pretty normal. You know, really takes about 3 months for that to kind of settle down. What have you gotten up to with therapy on flexibility?
Last time was 116, right?
Yeah.
116? Yeah, that's great. Yeah, for 7 weeks, 120 is our ultimate goal. We want to be at least that. But that's by 3 months afterwards. So, I mean, you're almost to your goal and we're halfway there. So yeah, super proud of you. I mean, I think things are coming along great. Your x-rays look great. Knee itself's looking good. Like I said, swelling will continue to go down. Still normal to have some kind of pain and soreness that's there. And that'll continue to settle down by that 3 month mark. But I'm proud of you.
I'm proud of you. You did a great job.
Well, good.
You and your staff have done a great job.
Well, good. I'm glad. That's the way we want it to be. So, any questions about anything?
No, everything's, everybody I talked to says, I had one guy I used to work with, he called and we talked 3 or 4 times and he couldn't believe it. He's talked to some doctors, down around home.
Mm-hmm.
I told him, I said, Dr. Locke, I said, the only part of me that was cut was my actual skin.
Mm-hmm. Yep.
Everything else, I said, no muscle was cut, no tendon or anything.
Nope. Yeah, that's the nice thing about it, for sure.
And she sent him a video that she's got on her phone the night we went home.
Is that right?
And you still got it?
Yeah.
I mean, I might have been a little crazy. But I was doing some stuff maybe I shouldn't have done.
Uh-oh, on the night of surgery?
On the night of surgery, but I mean, that's just the way I felt.
Let's see. I got the same one cut off.
Yep. Your dog's like, what are you doing? That's pretty amazing. I don't know if you can get that on there, but yeah.
Man, what a lifesaver. That's something.
Yeah, he's going to town on that thing.
Man. That's the day you got the surgery?
The day of
after surgery. Man was wasting no time.
Yeah, the day of surgery.
Wow.
So pretty amazing. Yeah, I'm proud of you. So yeah, I just kind of keep doing the exercises, working with therapy, and then usually I check you back in a couple months. But you're doing so good. You want to make an appointment, or you want to just call me at this point? Since things. Okay. Well, we'll just kind of leave it open then. Obviously, if there's any issues, you call me. Come on back. But I'm proud of you.
Thank you.
Yep. Very good. Well, if you give this to them up front, they will get you checked out. Okay.
Okay.
All right.
Thank you.
You're welcome. Have a great day, y'all. Proud of you. Call me if you need me, okay?
Yeah, sure will.
All right.
Right knee patient.
Yes. So new patient with right knee pain, pretty severe arthritis, completely bone on bone, a lot of valgus deformity to the knee. So, all right. Hello, how are you? Good. Dr. Logging, nice to see you.
Yeah.
This is Caitlin. She's my assistant helping me.
Okay.
Well, what's going on?
I've been having this knee problem about 10 years.
Oh, no.
My doctor on Warren Rollins says, keep shooting it. And I'm tired of it. I'm 71.
Right.
And it's sliding. And then that's sliding and my foot's sliding.
Right.
So I'm just hoping you'll fix me.
Yeah, for sure. Let's take a look at it. So they just want to keep giving you injections.
I've been trying to get it straight, but it doesn't straighten out.
Yeah.
And it catches sometimes.
Does it?
But yeah, they just want to keep giving me injections. And I'm just getting older and...
Yeah, the problem...
You can see it's sliding.
Yeah. So, if you look at your x-rays, here on the outside part of the knee, there's just unfortunately no cartilage left. And so it's completely bone on bone, and then it's really eroded that bone. You can see how that bone really dips down, and that's just because that the femur bone is grinding into it so much, is digging out the bone that's there. So then because of that, your knee is starting to bow outward. So you're becoming knock-kneed, and you can see the alignment. It should be a fairly straight line.
And see that coloring? Yeah, it just seems like it's just all on a line.
It is. It is.
And it's getting worse.
Yeah, and it will. That's correct. Because every day, more and more bone gets lost, and so then it slowly just keeps turning out. So, yeah, continuing to do the injections for me, I wouldn't recommend that. You're kind of at that point. You've got a fair amount of deformity as it is. The worse that deformity gets, it does affect your outcome after surgery. So we don't want to let that get too bad.
No.
So,
is it okay now to do the surgery?
No, it's still okay to do it. But I think it's good to go ahead and see about getting it scheduled for you.
Yes.
The way that I do the replacements is different than most people, and
I know, and luckily I found you.
Oh, good. Well, good. So, the traditional technique that most people use is they make that incision down the center, and when they do that, they have to cut into the tendon and muscle. But then you're trying to do therapy and bend it and move it, but it's been cut, so it hurts and it's hard to get the mobility back, and so that's what traditionally makes it take so long to get over and be fairly painful. So what we do is we come from the inside part of the knee, so we avoid cutting into that muscle and tendon altogether, so that helps make the recovery quicker return of mobility and muscle function, and then usually less pain as well. Still a knee replacement, but comparatively
major surgery.
Yep, but comparatively the recovery is much better when you don't cut the tendons.
Yeah.
So most people are up and walking right away afterwards. You usually use a walker for maybe a week, and then a cane for a week or two after that. So 2 or 3 weeks, you're getting around pretty good. And then by 6 weeks, most people are back starting to do most activities they want to do. It takes about 3 months for all the swelling and soreness to completely settle down. But like I said, activity-wise, by 6 weeks, you're back doing most things.
The physical therapy and everything.
Yeah, so you can do all that at home. Normally, we'd do home therapy initially. So we'd have you therapy come out to the house and work with you, and then you could transition to outpatient therapy after that. And you could do that wherever's close and convenient for you. Because I know you live in Byron, Georgia.
It's about 3.5 hours.
3.5 hours, not too bad. Thanks for making the trip down.
Yeah,
So-
yeah. Well, like I said, you know, I was reading about this and I'm like, man, maybe God wanted me to find him and go there.
That's right. That's right. But it makes, like I said, it makes a difference, and it's like, why should you have to endure a harder recovery if there's an easier way, for sure.
And the older we are, the harder it is.
That's true.
Anyway, so-
That's true. Well, do you want to think about it, or do you want to go ahead and talk to the scheduler?
I want to talk to the scheduler. And then how many times will I have to come back up here?
Yeah, so typically our normal post-op visits are usually 2 weeks after surgery, 6 weeks after surgery, and then around 3 months after surgery. But for people who do have a drive, we can always do like a telemedicine. So I can just call you, just kind of check in to see how the progress is going. Normally when you come back, we take x-rays, but if you're doing well, we don't necessarily have to do that. So we could always do a telemedicine so you didn't have to drive back so far.
No big deal.
That sound good? All right. Well, come on up this way and we'll go talk to our scheduler, okay?
Actually, we stayed at a Hampton Inn last night, and the man says, he just did my sister yesterday. She's 78 years old.
Is that right? How about that? Isn't that funny? I guess. All right, so 61-year-old patient here for gel injection for left knee arthritis. Hello.
How are you?
I'm doing good. How are you?
Good.
Good to see you.
You too.
All right, time for our gel. How's it been doing?
All right. It's always a time when it gets close to that 6 months.
Is that right?
Yeah.
It starts to let you know?
Yeah, it lets me know it's still there.
But it gets you close?
Yeah, it gets me close.
Okay,
Yeah,
good.
so it's good. I have a couple questions.
Yeah.
One, dentist said they no longer do the scripts for...
Oh, we can do it, yeah,
they said
whenever.
we do it.
Mm-hmm.
And the other thing is...
So we can go ahead and send that in. And not allergic to any antibiotics, are you?
Sulfa.
Sulfa, okay. So typically we do augmentin, and then I'll just send in like 20 tablets. That way you'll have a bunch on hand.
Okay.
Does that sound good?
Yeah.
What else?
So I have cancer.
Oh no,
Yeah,
I'm so sorry.
That's all right. They said I'm not going to die, so...
Okay, well that's good. That's good news.
Yeah, they said it's curable, so I just wanted to make sure anything that I need to know related to my knee, this knee.
Yeah, are they doing like chemotherapy or
I'll
anything?
find out in the next 2 weeks.
Yeah.
They're waiting on pathology still.
The only thing is like when you're on chemotherapy, it's not going to create any issues with it, but it is going to suppress your immune system to some degree. And so, it just makes you more vulnerable to like infections and potentially infection go into that joint. And so the big thing is you just want to make sure, if you had anything happen where you got a cut or something like that, probably good to take an antibiotic for that.
So don't worry. As far as this goes, there's no issue.
Mm-hmm. It'd just be like
Just
something
let them
else.
know that I have it.
That's right.
Okay.
Yeah, that's it. Well, I hope everything goes good. I'll be praying for you on that.
Appreciate that.
So you don't really know like how long the treatments will be or anything?
No, I don't know yet. They had to send the pathology out.
Gotcha.
On it still, so.
Well, I'll be praying that it's quick and easy for you.
Yeah, me too.
But at least it's curable. That's a blessing.
Yep.
All right, it's going to be a stick here. Doing okay?
Yep.
Good. Okay. Not too bad, was it?
Nope. Not any worse than the other times. I appreciate you.
You're welcome. And then do you want to do another 6 months?
Yeah.
Okay, so I will have them get you that appointment for 6 months.
Do you call that script into the pharmacy, or do I pick it up?
Which one do
Pick up this script? Okay.
Yes.
Okay.
No, we'll call it in.
You'll
What?
call it.
Yeah. What pharmacy did you already send it?
Early drug.
Okay. Yeah.
Is that good?
Yeah.
Okay. That way, by the time you get there, they hopefully potentially have it ready for you. All right, 6 months. All right, they will get you that appointment up front, okay?
Thank you so much.
Good to see you.
Appreciate it.
You take
Thanks.
care.
Bye.
Bye-bye. No issues there. Hello, hey, how are you? How are things coming along?
Okay.
Making progress?
Slowly but surely.
Slowly but surely, that's what we want. So, incision's looking good. That's healing really nicely. Are you putting anything on it?
Yeah, logging cream.
Logging cream? Okay. That stuff works really good.
Well, I started out 3 times a day. I'm down to 2 times.
2 times a day? Yeah, it's looking really good. Knee itself looks good. You know, still normal to have a little swelling, you know, soreness that's there.
What causes it to sting and burn real bad over here?
Yeah, so when we make that incision, you know, all those little skin nerves get cut. And so you'll get this numbness here, and then a lot of, that's right, and then a lot of sensitivity over here, and it's because those little skin nerves get cut. Okay. Now what'll happen is those nerves will heal, they'll start to grow back across, so you'll start to get some of this feeling back over here, and then that sensitivity, that stinging will settle down, but it's from the nerves.
Well, the physical therapist asked me to ask you, is there something over the counter you can rub on it? Because it bothers me real bad at night.
Yeah, so you could do like the Voltaren gel, so that Clofenac gel. So it's basically an anti-inflammatory cream. It's over the counter at the pharmacy. Yeah, and you can just rub that all over that area. So you can do the entire knee actually. I probably wouldn't put it right on the incision, but all here on that inside you can use it, over here if you need to. But that'd probably be something good. Voltaren gel, yeah. We could, I can write it down for you if you want, and that way you'd have it. No, not at all. I may just use this little piece of paper here. All right, so it's Voltaren gel.
Okay.
Yep. They make a generic of it too, which is just, it's called diclofenac gel. So either one, they're the same thing. It's just, this is a brand and that's generic.
Okay.
So, but they're both over the counter at the pharmacies. Okay. So
that was all I had to ask.
Okay.
I'm getting better with my physical therapy.
Yeah.
I'm pleased with what she says I've done.
Yeah, no, you're doing really good. I'm really proud of you. So big thing, I just kind of keep working with therapy with her, and hopefully, keep getting the more mobility and building strength back up. And then usually I'll check you back in a couple months just to make sure we're still making good progress. Okay. Does that sound okay?
Yeah.
But I'm proud of you.
Okay.
Any other questions?
No.
Alrighty. Well, if you give this to them up front, they will get you that appointment for a couple months, okay?
Thank you.
You're welcome. You have a great day, okay? Bye-bye. Hello.
Hello.
How are you?
I'm fine. How are you?
Doing good. Time for our gel.
Yeah. You got anything for a snap, crackle, pop?
That's it.
That's what I feel like in the morning sometimes. I get up and there's a snap, there's a crackle, or pop. You know, cereal.
Rice Krispies.
Oh yeah.
We'll put some milk on it, right?
Of course. Of course.
All right. You comfortable there?
Yeah.
All right, well, hopefully this will help calm some of that cracking and popping down.
Well, it's not only the knee, it's the whole body.
The whole body, oh, poor thing.
I feel like some days I'm falling apart.
No.
I went to the beach for the weekend.
Oh, that was good.
It rained.
Did it?
My mother-in-law's got a new puppy, and he's 7 months old, but he's the size of a grown deer.
Oh, geez.
And he wore us out.
Did he really?
He did. Jumping, running, but I did make it to the beach.
There you go.
And I've got my cruise coming up in 2 months.
Nice.
Yeah.
You excited?
I am. I've got a couple of things scheduled for events and everything, so I hope the knee will behave itself.
Hopefully so. Well, this is a good time to get it because, you know, it takes a good 4 to 6 weeks to get the full benefit of it. So
Right.
hopefully by the time the cruise rolls around, it's kicked in really.
That's what I had my fingers crossed hoping for.
Yeah,
you know.
absolutely.
It was time to get it done because coming back from the beach, I went, you know, that knee kind of feel like it needs some help. And then I had my appointment coming up.
Good. And then do you want to go ahead and make the 6 months?
Sure, definitely.
All right, well, I will have them.
Okay, and I'll start taking WD-40.
How that works out. Oh, goodness. All right, 6 months, gel. All right, they will get you that appointment up front, okay? Well, have a great trip, okay?
Thank you. Have you done any trips lately?
Not lately. So next year I got a few things on the docket. So hopefully we'll get some good animal experiences. So.
Sounds perfect. Thank you so much.
You're welcome. You have a great day, okay? All right, bye-bye.